you asked, so let's talk recommendations for people studying to become a therapist. And these recommendations are going to apply to practicum, internship, and residency. Number one, if you haven't done your own work, if you haven't done your own therapy, get into your own therapy now. It is so helpful to know how it feels being on the other side. And also sometimes that your therapist that's a good fit for you, you might pick up some things that you might like about how they interacted with you and about your experience. You can really learn from your experience in your own therapy. Number two, don't forget the fundamentals. Listening skills, reflecting content, reflecting back to the client, and really building that therapeutic relationship. That is the most important part of what you're going to do. Tip three, go on ahead and practice your introduction, how you might introduce yourself. Do that with some family, friends, just so you're used to introducing yourself and you kind of have an idea of what you might say. I think I'm on number four. When a crisis does come up, immediately contact your supervisor. You are under their license and they want to know if you have any major concerns, if there are any major issues. Also, when you make a mistake, reach out to your supervisor because you are learning, you are growing. Finding the right fit with a supervisor is key, but you often don't have a choice with who your supervisor is. So if you end up with somebody that isn't a great fit, you might reach out to other people for additional mentorship. But you have to go back to whoever you are working under, because let's say the person you're working under, you don't like their recommendation, you are technically practicing under their license. Next tip, get ready for imposter syndrome. And as a baby therapist, of course, imposter syndrome is going to show up. You're not going to feel like you belong. You're going to feel like you don't know what you're doing. Remember that you are learning and you really are kind of figuring this part out, and that's okay. Be kind to yourself. And when you watch tape, make sure to find what you did well, and then also look for the things that you would like to change or something that you might have liked to do different. Even now, there are times that I might have said something different or done something different in a session, but I don't beat myself up for that. So observe other clinicians if you can. So some people that have a little bit more experience, see if you can observe them, and you might like some things about what they do, and then be your own person, because you're going to find these things out over years. Over the next few years, you'll kind of figure out the type of clinician that you want to be. And lastly, accept things outside of your comfort zone as long as it's within your supervisor's scope of practice.